Hello everyone, my name is Maliha Hakshima and today I am going to talk about blood supply of esophagus. Introduction. Esophagus is a narrow muscular tube extending from pharynx to the stomach, descends in front of the vertebral column, goes through superior and posterior mediastinum. It begins with lower part of the neck at the inferior border of the cricoid cartilage, extending to the cardiac orifice of the stomach. It gives passage for chewed food and liquids during the third stage of deglutition. Anatomical positions. Anteriorly, the trachea, the recurrent laryngeal nerves ascends one on each side in the grooves between the trachea and the esophagus. Posteriorly, there is prevertebral layer of deep cervical fascia, longus colli and vertebral column. Laterally, on each side lie the lobe of the thyroid gland and the carotid sheath. Parts of the esophagus. The esophagus is split into the following three parts: cervical part, thoracic part, and abdominal part. Cervical part is 4 cm in length. The cervical part extends from the lower border of the cricoid cartilage to the superior border of manubrium sterni. Thoracic part is 20 cm in length. Thoracic part extends from superior border of manubrium sterni to the esopharyngeal opening in the diaphragm. Abdominal part is 1 to 2 cm in length. The abdominal part extends create esopharyngeal opening in the diaphragm to the stomach. Arterial supply. The cervical part is supplied by inferior thyroid arteries. The thoracic part is supplied by esopharyngeal branch of descending thoracic aorta and bronchial arteries. The abdominal part is by esophageal branches of left gastric artery and left inferior phrenic artery. Venous drainage. Cervical part is drained by inferior thyroid veins. Thoracic part is drained by azygos and hemiazygos vein. Abdominal part is drained by two venous channels. One is hemiazygos vein, which is a tributary of inferior vena cava, and the other one is left gastric vein, which is a tributary of portal vein. Thus, abdominal part of esophagus is the site of portocaval or portosystemic anastomosis. Lymphatics. The lymphatic drainage of the esophagus is divided into third: superior third, medial third, and lower third. Superior third is deep cervical lymph nodes. For middle third, there is superior and posterior mediastinal nodes, and for lower third, there is left gastric and celiac nodes. Nerve supply. The esophagus is supplied by both parasympathetic and sympathetic fibers. The parasympathetic fiber originates from recurrent laryngeal nerves and esopharyngeal plexus, which created by vagus nerves. They supply sensory motor and secretomotor supply to the esophagus. The sympathetic fibers originate from T5 to T9 spinal segments, are sensory and vasomotor. Thank you so much.